My name is Lindsay McCauley, and I'm going to be giving my presentation on Spina Bifida. I remember growing up with my cousin and trying to understand why he couldn't do the same activities that most people could. After wrapping my head around the diagnosis of Spina Bifida, I learned that it affected his spine to the point where he had no feeling below his waist. Before you stop and stare at someone in a wheelchair or with an interesting strut in his or her step, it is important that you understand that Spina Bifida could be the reason that makes him or her different from those around him or her. As a close relative that has assisted in the care for my cousin, I became familiar with the seriousness of the disorder. Today, I plan to give a brief talk about Spina Bifida, the effects, and the treatments. I'll first start by explaining the disorder itself, then I'll explain how it affects people living with it, and lastly, I will provide possible treatments that can help or reasons that can make those living with it live a happier life. Now, let's begin. According to the Mayo Clinic, Spina Bifida is a birth defect that includes the incomplete formation of both the spine and the spinal cord. There are three different types of Spina Bifida that include Spina Bifida occulta, Spina Bifida meningocele, and Spina Bifida myelomeningocele. Occulta is a more mild version and includes a small gap in the vertebrae. Meningocele is when the protective membranes surrounding the spinal cord push out through the vertebrae, and myelomeningocele is the most severe and is when the spinal canal is open along several vertebrae. Now, I will explain how Spina Bifida affects those living with it. According to SBHI, or Spina Bifida Hydrocephalus of Ireland, the effects of Spina Bifida are usually dependent on the type, location, and severity. But the cases that I'm familiar with include paralysis, pressure sores, and a lack of bladder control. As a result of myelomeningocele, the spinal cord is irreversible with damage, as well as nerves after the spinal cord juts out of the spine during pregnancy, causing paralysis. Pressure sores develop when heavy pressure is against the skin, and those that use a wheelchair are usually the ones to attract them from sitting in the same spot for a long period of time because of the paralysis. Myelomeningocele brings out a lack of bladder control because the nerves that control the bladder are in the low region of the spinal cord. So when the nerves are damaged, incontinence may be present and it may lead to infection. Lastly, I will explain the possible treatments and ways to help. According to the Children's Hospital of Philadelphia, the two main treatment options for Spina Bifida include fetal surgery during the pregnancy or surgery shortly after the birth. After surgery, follow-up appointments throughout a child's life are typically necessary as well. Prenatal surgery on the fetus can prevent further damage as it continues to develop and is usually performed between 23 and 25 weeks of the pregnancy. For postnatal Spina Bifida surgery, a cesarean section is often planned, and the baby is put under general anesthesia for the MMC sac to be removed 1 to 2 days after birth. The decision on prenatal or postnatal surgery is often dependent on not only the factors of the fetus, but also multiple maternal health factors. CHOP's Management of Myelomeningocele study compared prenatal and postnatal surgery outcomes and concluded that prenatal repair of the myelomeningocele lesion often provided better results. From the start of Spina Bifida to ways of treatment, you should now have a better understanding of the disorder. In conclusion, I provided details on the disorder, details on the effects, and details on the treatments and ways to help those with spina bifida. Next time you interact with someone who has this, try and put yourself in his or her shoes and understand the severity and challenges that this person may face. Do any of you guys have any questions? No? Okay, well I have one question for you. When is prenatal surgery on the fetus usually performed?
Was it 23 to 25 weeks?
Yes, that is correct. Good job, Gracie. And that is all. Thank you so much for your time.